Welcome back to your class. We're continuing our landmarks, right? I'll just share the screen. Okay, all right. We have covered till the nose, right? We have covered till the inferior nasal concha we have completed. So today we will be progressing forward. Okay, we're still on the maxilla. So we'll be talking about the next is the incisive foramen. Okay, so the incisive foramen, it is also known as the nasopalatine or the anterior palatine foramen. It is a radiolucent image between the roots of the central incisors. All right. The oral terminus of the nasopalatine canal transmits the nasopalatine vessels and nerves approximately at the junction of the median palatine and the incisive sutures. So what do we have to remember over here? That it is a radiolucency. It is called a pear shaped. You may write it down. Okay. Wait, I'll just write it here. Okay. So it is a pear shaped, or it's an inverted pear shaped radiolucency that is seen between your two central incisors, the roots of your two central incisors. All right. Okay. So next question that we ask is, in which X-ray will we see the incisive foramen? Tell me which X-ray, if it is between our incisors. So whenever you're taking the X-ray of your central incisors, we will see your incisive foramen or the nasopalatine foramen over there, right? Now, what is the pathology associated with it? If it is enlarged, that is, if it is bigger in size, or if it is displacing the or resorbing the roots of the adjacent teeth, then it could be any cyst, okay, like an incisive canal cyst. This is denoted whenever the enlargement of the foramen is more than 1 centimeter. Okay. Okay. Like even over here, you may see it is very evident over here, and here it very slightly you can see. All right, between in the apical region of your central incisors. Okay. Now the next foramen that we're talking about is the superior foramina of the nasopalatine canal. Okay. Just put my screen here. Yeah. Okay. Yeah, that's better. So the superior foramina of the nasopalatine canal. Why is this here? Just a second. The inverted pear is still there. Just a second. Okay, eraser. Yeah, okay then. Let's continue. These are two radiolucent areas above the apices of the central incisor in the nasal cavity floor. Okay. So before I show it to you on the IOPA, let us see over here. This is a maxillary occlusal radiograph. Okay. So this is, how do we take this radiograph? We have a bigger sized film which we place between the teeth, maxillary and mandibular arch. Okay, it is a rectangle. Now, after placing it over there, we will angulate the X-ray beam. Sorry, from we're talking about maxilla. So we will angulate the X-ray beam from here, and we will get the image on the like this. Okay, so can you see these two round these round radiolucencies? Again, we'll come to that. Radiolucency means an area where there is less of bone, because it is a foramen. Foramen is a hole. Hole may there will be less bone. So this foramina will appear as black. Okay, and where is it located? It is located above the byssus of your central incisors. Okay, now if I ask you that where can you see it over here in the IOPA? In the IOPA also it is visible. Can you see here? The two radiolucencies, but it is a little not so clear over here because it superimposes on a lot of structures around the nose. So that is why whenever we want to see the superior foramina of the nasopalatine canal, we will always prefer a maxillary occlusal radiograph. Otherwise, it is also seen in your IOPA, right? Okay. So the two radiolucent areas above the bicep central incisors in the nasal cavity floor on both sides of the septum, it is either round or ovoid in shape. Okay. Before this, we were talking about the incisive canal. So that was an inverted pear shaped. Okay. Over here, the shape for this is it is either round or it is ovoid. Okay. Hope you people have understand these two foramens or the canals. Okay, now the next is a fossa. Okay, that is a lateral fossa. Okay, stop reading. First, just listen. Lateral fossa. Okay, it is lateral. Lateral to what? It's not lateral to anything, but it is lateral to your lateral incisor. Okay, so we're talking about a tooth here. The fossa which is associated with the lateral incisor is the lateral fossa. It is seen near the apex of the lateral incisor. Okay, see, this is a central incisor and this is a lateral incisor. So lateral to your lateral incisor, there is the lateral fossa that is also known as the incisor fossa. Again, a fossa means a depression. We will to understand this much better, when you did carving, you all must have done teeth arrangement, right? So when we are doing the carving, when we're giving the scalloping for the teeth, the side between the lateral incisor and the canine, we give a deeper groove. So that is the lateral fossa that we are carving. Okay, so it is a radiolucency over there, lateral to the lateral incisor. Then the nose. Okay, very simple. There's nothing to explain over here. The nose is superimposed on the anterior maxilla. It is a slightly opaque appearance with a sharp border. Okay, so the nose is superimposed on the anterior maxilla and it is an opaque appearance, like a veil. It is an opaque veil. Can you see over here? You can see the two central incisors, and can you see a white line which is like, it is opaque, more opaque above and it is less opaque below, right? A lot of whiteness over here. So that is the nose, because when we're taking IOPA of the central incisor and we're making the patient bend a little and we're putting the cone here. So before the x-rays touch the teeth, they also pass, majority of them pass through the nose, and majority of the x-rays are blocked over here, which causes the opacity, right? Okay. Okay, now next. Now we're coming to the nasolacrimal canal. What is the nasolacrimal canal? It is seen near the apex of the canine. Okay. There is a steep vertical angulation in a and it is seen whenever there is a steep vertical angulation in a periapical radiograph. It is routinely seen on the maxillary occlusal projection in the molar region. So again, before this also we talked about one foramen, okay, the superior foramina of the nasopalatine canal. Now we are talking about the nasolacrimal canal. Okay, so the nose and the lacrimal, these two, where it's connected, where it opens into the mouth, there are two foramina over there. If you put your tongue on the canine and you go above it, see, feel. Okay, now the apex of the canine, that is the region in your x-ray where you're going to see the nasolacrimal canal. Okay, and it is usually not seen in all the IOPs. It is only seen when there is a when we have increased the vertical angle. Okay, but it is routinely seen in maxillary occlusal radiographs. Okay, and when we are seeing it on the occlusal radiographs, again this point you have, it's not written down, you may note it down, or you may just remember that when we take the radiograph over for this, we see it around the molar region. Okay. Okay. Okay, now next. Now we come to your maxillary sinus. Okay. 1 second. Yeah. So now maxillary sinus is a very, it's a very important, it's a very important part. Okay, the maxillary sinus. Now why is it so important? Because it is the major area over here, that these two hollow cavities which have a lot of functions, which you must have already read in your anatomy in your first year. All right, so we will start reading this. The maxillary sinus is an air-filled cavity with a mucosa lining. Okay, it's a pyramidal or triangular air-shaped cavity with a mucosa lining. It's a three-sided pyramid, base and the medial wall adjacent to the nasal cavity, and the apex extending laterally into the zygomatic process of the maxilla. Okay. So what is the shape of the maxillary sinus? It is a three-sided pyramid. Okay. So what is a three-sided pyramid? We are saying that the base and the medial wall is adjacent to the nasal cavity, and the apex extends laterally into the zygomatic process of the maxilla. So the apex is here and the triangle is like here. So the base and the medial wall is adjacent to the nasal cavity, forms the sides. What are the sides? The superior wall is the floor of the orbit. Okay, the floor of the orbit is the superior wall. The anterior wall extends above the premolar, and the posterior wall is bulging above the molars and the tuberosity. Okay, this is important. You need to learn this. The superior wall is the floor of the orbit. Okay, upper orbit hai. Then anteriorly is the premolar, and where is the posteriorly? Posteriorly it extends till your molars and the tuberosity region. Okay, another thing to note over here is that it is bilaterally symmetrical. Okay, exactly left and right are similar. Okay. Okay, now we'll come to the presentation. Okay, whenever we take a radiograph of the premolars and the molars, that is where we find the maxillary sinus. When we're talking in the posterior region, anteriorly I will come to after this. Right now we are seeing in the posterior region, so it is near the your premolars and your molars. Okay, let's read this out. It is a thin radio opaque line near the apices of the upper premolars and molars. Okay, it enlarges during childhood until the age of 15 to 18 years, and it may change during adult life in response to environmental factors like missing teeth. Okay, all right. So because the children's maxilla is growing, so even the sinus is growing, it keeps growing, it reaches its maximum size till the age of 18. Okay, but after that also the size and the shape of the sinus changes in response to environmental factors. Now what are the environmental factors? Like any tooth is extracted, okay, or any tooth goes missing, it's fallen off, any other reason, so the shape over there is going to change. All right. Okay, now in puberty, the floors of the maxillary sinus and the nasal cavity may be present at the same level and may extend further into the alveolar process in the older age. Okay. So in the puberty, the floors of the maxillary sinus and the nasal cavity may be present at the same level and they may extend further into the alveolar process the older age. What does this mean? If you see over here in the first, you can see where the sinus lies. It is at the apices of the teeth. As we grow old, as the teeth are extracted or they fall off or any other reason, so what happens is that the alveolar process starts getting resolved. Okay. Now, once the alveolar process is resolved, now what happens after that is that the height will decrease, will go up. Now, once it goes up, see, can you see in the last over here? See, this is the end of the alveolar process, and you can see that the maxillary sinus has dipped down so much that it has covered till the alveolar process fully. Right? So these are the changes. Now, I told you about full teeth and full missing teeth. Now, if you see the second diagram, this shows a transitional stage. Look over here. In between these teeth, there was some space. Okay. So, because of the bone loss, the alveolar crest has come down over here, and it is very nearly impinging on your alveolar sinus. Okay, so this was how it is here. When we draw it, it's like it starts from here and then down and down and then up. So this was in the posterior region. Now when the sinus, like we read the bases, okay, so it's from here, this anterior premolars and posterior here. So when we are taking premolar radiograph, putting our cone in front of us over here, what happens is that there is an inverted Y-shaped, or it's called the Y line of Ennis. Okay, so what happens is this, in this, the Y line is formed in the canine or the premolar region in the periapical radiographs. The root apices may cause small elevations into the floor of the sinus. The lamina and the floor of the sinus may fuse as a thin layer of bone covering the apex. Coming back to your Y line of Ennis, okay. I will remove my photo from here, yeah, okay. So can you see over here? What two structures over here? What structure is over here? What radiolucent structure do we see over here? The nose, right? What radiolucent structure we talked about till now over here? The maxillary sinus, okay? So now what is the Y line? It is the line that is formed from this nasal, by the junction of the nasal fossa, okay, outline, and the maxillary sinus, where these two come and meet. Okay, can you see over here? So it's called the inverted Y line of Ennis, and this is seen above your canine. So whenever I ask you to take a canine radiograph or a first maxillary, first premolar radiograph, most probably, if you've angled it correctly, you will see two white lines like this and one extending up. So that is the Y line. Okay, done?